Hi everyone, I'm Dr. Cheryl Karthaus, Naturopathic Doctor, and welcome to the Tick Spray Essential Oil Workshop and Lyme Disease 101. Let's get started.
Welcome to the workshop this year as part of Naturopathic Medicine Week on Lyme disease and as a tick spray too, which we'll demonstrate later at the end. It is Lyme Disease Awareness Month every May, so I thought that quite fitting to also add in a talk about Lyme during Naturopathic Medicine Week, which is ending this upcoming Saturday. So a little bit about me, I'm Dr. Cheryl Karthaus. I'm a naturopathic doctor. I've been supporting people with Lyme cancer and different complex chronic disease since about 2016, 2017. I went to the Naturopathic College in Toronto, which is the CCNM, the Canadian College of Naturopathic Medicine, and I graduated from Waterloo, but I got my undergrads. So I've been doing this for a little while. I've given a ton of talks on Lyme and different herbs around Nova Scotia, different Lyme-based events and different like herbal workshops and stuff like that. I've actually done the tick workshop a few times in person, which has been fun too. Today, we're going to go through a whole bunch of Lyme info, which will include prevention and safety measures, Lyme disease, co-infections, some of the symptoms, testing options available in Nova Scotia, treatment options, and then we'll go right into the tick spray workshop. If you have any questions, feel free to add them into the chat as we go along, or if you'd like and you don't mind being on the recording here, you're welcome to just unmute yourself and ask a question as well. This is an awesome Lyme disease fact sheet that the Nova Scotia Department of Health and Wellness put together. This was put out by Saltwater Network a few years ago, and I haven't been able to find it again. So if you have the opportunity, I would actually suggest to screenshot it if you'd like to go through these. One of the comments or myths that I hear a lot, or that I would try to explain to people, is this number 3 here. All Lyme victims develop this bullseye rash. That classically is what will diagnose Lyme in a clinical setting. And it's common for people to get different types of rashes, but really only about 9% develop that classic bullseye rash. So 9% of 100 who would, have Lyme is really, really small. And that is part of the issue, that if this is our main diagnostic criteria, it doesn't know where ticks found. Ticks are found all around Nova Scotia. And as we can see from this graph, this was done in 2015. Nova Scotia has way more ticks than a lot of other provinces. We have a really, really high deer population as well. And so that likely is what's encouraging them to feed. And then where are they found as we are, gallivanting around our province? Around the grass, short grasses, typically long grasses at the sides of paths around forest, or areas that are frequented by other animals. So often if you're bushwalking or hunting or just playing in the forest, deer will also take those paths, and then the long grass will be at the sides of them. And that's where ticks kind of hide out, and they hold on with their bottom 2 feet, and then they reach up their other legs, and that's how they actually grab on to usually or an animal or something that's passing by. And one of the other common places is that if they're not necessarily on you at the time, or they're on backpacks or clothing, they can end up in your car. And so often I hear people say that they hadn't been outside yet, or they rarely go outside, or every time they go outside, they do a tick check. Like, okay, but how often has your dog been in the car? Or how often have you placed your backpack down somewhere, maybe in long grass, and then you were sure to check yourself, but you didn't quite check the backpack, or they could be hiding in a little nook and cranny there. So just to be mindful of places that they actually can be. And when people say they didn't see a tick, or they didn't see a rash, or any of these common things that we expect to happen when ticks attach and Lyme disease is a possibility, I kind of think like, okay, well, it's not always that we would actually even see the tick latch to begin with, because it could be in the hair, or it could be at a time when you didn't see it. But again, as I mentioned, there's only about 9% of people actually get that rash. So they can come kind of out of nowhere. So just to be mindful a little bit of that. Prevention. Ticks tend to only climb upwards. It's more of an instinctual thing for them. So when you layer, it's ideal to layer a bottom layer on top of a top layer so that they won't hit that lip of a layer, if that makes sense. So tuck your pants into your socks rather than the other way around. So that when they climb up, they wouldn't actually be able to sneak underneath. And they do tend to just climb upwards. So a lot of people, the most recent ones that I've heard have all been found around their ears. I had one latched on my ear a couple years ago, but really that's been actually the only one in Nova Scotia so far that I've gotten. And so around the ears and around the head are often places that can be found. Sometimes in the groin, especially if people aren't tucking or wearing shorts or aren't tucking their pants into their socks. And we'll go into more body positions as well. These are guinea hens. The chicks are super cute. The adults are actually quite ugly in a beautiful way. And they do eat ticks. So there's been a number of people around Nova Scotia who are actually getting ticks or getting guinea hens these days to try and eat more of the ticks around their yard. A little dark place. Definitely the groin area, that's hot and warm and moist very often. Check all of the cracks that you can, at least rub your fingers through all of those areas so that you can see or feel if you notice any other new bumps and whatnot. Anywhere that has hair, so even within your legs or groin areas, body, anywhere that you would have hair can also be a little nice little tucked away hiding spot. Sometimes in the armpit. So, and if women have larger breasts, you may want to check under the breasts as well, or any other folds in the skin and in the body. And then around the ears, that's actually where I found my tick a couple years ago. I've only actually found one latched onto me in Nova Scotia, but I'm sure other people have had for different experiences. So definitely check around your ears, check around the headline, around the hair. It can be difficult with longer hair as well. Try to brush it out, take a shower when you get home. The time that I did find a tick latched the next morning, we did all of those things because we went to an area that was quite tick infested, and it still was there in the morning. So sometimes you do all of the checks, whether it again crawled from a bag or other clothes that were on the floor or something like that. Just continually do tick checks, and if you find them, you can try and get rid of them as best that you can. And through doing this tick removal, if in doubt, always get help. I did pull a tick off of a dog and did break it, which is really what you want to try to not do. So if something looks like it's embedded really deeply or you want additional help, feel free to go to a clinic and have that help. So tweezers are one method. You can just get up down really, really low to the skin, clip the tweezers really, really, really tight, and then you pull straight up. A straw and knot, which would be that you put the straw over the body of the tick, and then as you can tie a string into a knot, put it around the straw and push it all the way down to where it would be right against the skin, and then you tie the string really, really tight. So essentially you're getting all the way right close to the tick. If you use like a really thin thread, that would be great because you can get really low. You want to also be careful to not break it. An intradermal blister we can do in clinic. So basically we push some saline or material, usually would just be saline, under the skin and make a little bubble from where the tick is feeding. And so that it can't actually feed and there's too much pressure and it will sort it back out. So this is one example of using tweezers, and this is from the Lyme website, CANLYME. They have really great resources, and they'll pop up a couple times as a resource. And this is another version. I also had a friend report that they used a Q-tip. So they use a Q-tip, and when you just do a little circle right around where the tick is embedded. And as you continue to go around, I think she said it took like 2 minutes. So the skin's quite raw and uncomfortable by the end of this. But you're going around in a little circle there. It puts a lot of pressure on the area. And I think one of the, oh, great. Thanks. Yeah, there's some resources there in the chat. That's wonderful. It changes the blood flow to the area of where the tick is feeding. And so she was saying, as you're going around and around, every pass that you go, the tick would kind of wiggle and move out a little bit because of that change of blood flow. And so I think these types of, they're not really tweezers, but these types of removal tools they would hook under the tick. You'd put the little wedge under the tick or around the tick. It's sort of like a fork, which you can't quite see in this picture. And then you twist them. So I think it might be a similar idea, is that you're putting pressure around the tick, and then it would kind of back out with every turn. Okay, and then so we're back at here, our Lyme disease, which I think is where you couldn't hear me, but I was talking the whole time. Okay, so Lyme disease. The diagnostic criteria for Lyme disease is typically this bullseye rash, but as we have learned, there's only about 9% of people who actually get the rash, which means there can be a lot of missed Lyme disease cases. I don't need a test to properly treat for Lyme. Typically, if you do go in and have any sort of rash, really there should be some treatment, because the really only rashes show up about 30% of the time, with the target rash being about 9% of the time. So we don't need testing to treat. Often if people get a tick bite, you will get usually at least a couple days of doxycycline from a walk-in clinic of some sort, or maybe from your local or your personal MD. Symptoms. So one of the reasons Lyme disease is missed so much is because the symptoms vary for many different people. So often some of the first symptoms will be that of where somebody had an injury before, or a susceptible tissue in that way. And they can just vary. So that picture is just so different, and it's part of the issue with finding proper criteria that will actually diagnose Lyme disease. Because if you could go in and say, oh, my throat hurts and I have bumps on my tonsils and they're really swollen and those bumps are kind of white, you probably have strep. We'll give you some antibiotics and we can go from there. But with Lyme, when everybody comes in and different joints hurt and their level of fatigue is different, and just so many of these things vary. Some people have nerve pain, some people don't. It can be really difficult to diagnose Lyme. And co-infections kind of go into this category that I'm talking about, which we will explore. That's one of the issues with it. Lyme is Borrelia in particular. So that's the particular bacteria that actually creates the Lyme disease itself. It's most commonly has central nervous issues, so a lot of different neurological kinds of things. It is a master of disguise. So this is a common way that it's referred to, because it can look like MS, like multiple sclerosis. It can look like Lou Gehrig's disease, which is ALS. It can look like fibromyalgia or chronic fatigue. It can look like a whole lot of different things. And that's, again, as I mentioned, one of the issues with proper diagnosis of it, and trying to then properly treat if the diagnosis is missed or misunderstood. So wandering arthralgia, that wandering joint pain, is one of the most common symptoms, that classic symptom. So if you have one knee that's totally swollen, and then the next morning you wake up and it's completely gone and it's gone over to the other knee, and people will come in and they say, like, I think I'm crazy. Like, this was a wreck yesterday. I couldn't step on it. I couldn't put any weight on it at all. And like, it's total, I mean, I'm coming into you today and it's totally fine. Or it will bounce around to different joints and be, on their elbow or their shoulder or fingers or hands or wherever. So that wandering arthralgia is one of the classic symptoms. This internal vibration is another one that comes up a lot. There's a documentary that I was in a few years ago, and often it's actually in there too, one of the women who describes it, but I've heard a number of people describe it as the fuzzy gray and white static that happens when, those old TVs would have antennas, and it kind of goes like that fuzzy white and gray static that's there. That's what it feels like inside their body. So an internal vibration, or what's called formiculation, where it feels like there's something crawling under your skin. Not actually like there's no ticks or anything crawling under the skin, but it can feel like that. And so it can have a lot of these neurological sensations. Emotional changes are often a big one, especially in children. Depression can be a big part of it. And then there's that whole other mental component of something like that, where you don't feel heard properly, and where you feel like you're going a little bit crazy, and where sometimes people don't fully believe you, especially in the medical community. And it can often be difficult to get out of bed. So one of the unfortunately repetitive stories that I've heard is people coming in saying, I don't know if I'm crazy. Other people tell me this, and I haven't gotten really any support for these things and these symptoms that are ongoing for years sometimes. And I've been given antidepressants, and they don't usually typically do anything, because I think for those people, usually getting out of bed in the morning isn't because of a depression, it's because of the fatigue and all the other symptoms that they're having. Babesia is another co-infection. So when tests are done for Lyme, and I'll get into this a little bit more detail later, they are done only for Borrelia, that particular bacteria. And something to keep in mind too is that there's a number of different Lyme species around. About 16 was the last number that I heard of in Nova Scotia that were found. And the Lyme test for the antibodies in the system. And even for some of the other tests that we have, it only tests for 2 of those species, not for all 16 of them. So even if we're doing our best due diligence to test everything that we can, and you're having all these symptoms, I would just treat for it, because maybe it's not actually Borrelia, maybe it's one of these different co-infections that we can actually test for, but our typical medical system doesn't test for. So Babesia is one of the other co-infections that often frequently can come along with Lyme. There can be more like night sweats and hot flashes. These cherry angiomas, they almost look like little, a little bit bigger than a pinprick, but little pinpricks kind of all over, like not quite a rash, but little dots that just sort of pop up all over the body, or on certain limbs. And they can be a little bit elevated, and that can be one of the classic symptoms. Buzzing on the bottom of the feet is one that I hear often as well. And dental problems. So dental problems, if you dig into the world of biological dentistry, which is essentially the naturopathic version of a dentist, you'll start to learn that issues within the mouth are because of an imbalance in a bacterial flora and how that environment looks. And so very often when people are infected with Babesia, their teeth will start to crumble, or they'll have all these different issues that shouldn't, with good diet and whatnot, that really shouldn't happen. And then I'll actually just make another point here. The very bottom point there is a synergy with mold issues. And we'll get into that idea that there often can be multiple things going on, which is where we get into this idea of complex chronic illness. Bartonella is another co-infection. It can have a lot of neurological types of symptoms as well, and definitely a lot of central nervous system issues. There can be a lot of anxiety and this Bartonella rage, where people will just all of a sudden be so angry and kind of in this rage for a time, and then they kind of can snap out of it and say, like, I don't know why, like, this is not me, I've never been this kind of person before. And this sort of thing is happening now. Cat scratches, these are big purple lines typically that are on the torso, and those are another classic sign, sort of like the bullseye rashes for Borrelia. The cat scratches are for Bartonella. So if you randomly have these purple lines that just show up on the torso, they essentially almost look like stretch marks. And if they come out of no reason, that you're not, a growing teenager or pregnant or something else that should have growing stretch marks, that they could be attributed to this, especially if you have obviously other symptoms that come along with it. Some of these symptoms are just of interest to note, and we'll talk about it in the treatment section, is that it can affect different organs, and we can have insomnia, and we can have digestive issues with heartburn and gastritis, which is inflammation in the stomach. So being able to support those tissues is really important when we get to the treatment part. Ehrlichia and anaplasma, these kind of go together because they're often tested together. You can have leg pain, wandering pain from joint to joint. So this can look a lot like Borrelia as well. Often people will report they had the worst flu ever in the summer, which is often, weird. We don't usually get flus in the summer, and different things like that can kind of pop up that look like some of the other co-infections as well. Mycoplasma, one of the major things with mycoplasma is that people have respiratory issues. I will always test for mycoplasma and or possibly treat it. especially if there's no response to other antibiotics. So if you get doxycycline and everything looks like Lyme still, or there's some things that maybe don't look perfectly like Lyme, but they look like this other chronic fatigue and different things, and that report of onset of when everything started is really abrupt, that can be, maybe it's just a different infection. Like, well, I had a big rash. I was in the jungle or in the forest for a day, and after I had a really bad flu, or that night, or something felt weird on my body, then I started feeling sick, and I've never been well since. Especially when it's that abruptness, then it could often be either co-infection or Borrelia itself. There are other books that I've read that look into sort of the history of Borrelia as well. And there are some reports that the ticks can also be infested with lots of different viruses. And you can have these different viruses that are either now part of the system and causing illness, or that you can actually get a retroactive virus, which is an activation of a virus that you maybe have either had in the past as an actual infection, or that is just around from past illnesses, with even if you didn't get crazy sick from it. So EBV, Epstein-Barr virus, which gives us mono, is one of those ones that sometimes can be reactivated as well. So if you have that abruptness of been really sick, never well since, all of these symptoms are coming up, I often will treat it as an infectious issue, whether it's one of these bacteria that we actually can test for or not. Tick testing itself. So if you can actually pull the tick off or keep the tick, and you want to know what is in those ticks around you, you can send them to the best place is the Lloyd Tick Lab. That is in New Brunswick. She's wonderful, Dr. Vet Lloyd. And she has done a lot of research, really dedicated a lot of her work to this. I believe she had Lyme disease herself at one point. And that would be the place that I would send them. They do Lyme, and I believe they do at least a number of co-infections. You may need to request it specifically. Health Canada has these other ones, but the numbers change, the emails change, and sometimes they were being sent to Winnipeg for a while. It would take months and months and months to get a return on it. So I would definitely send them to that first one there. And this is what the website there looks like now. All right, so if we have an acute bite, just had a bite, now what? There's various information on, well, we'll back up a minute here. There's various information on how long the tick needs to be attached for. Because of this regurgitating effect, if it has fed at all, I would suggest, treating it at least with herbal remedies and whatnot. If you can get doxycycline or other things like that, if you think it has fed that much, I think that would be important. You can't get Lyme or any of the co-infections from the tick crawling around on you, or if it hasn't latched, and even if it's just latched, but you can pull it out really easily, so it's just attached to the skin. So if it hasn't fed at all, there have been reports or some ideas that really it can be attached for as little as 15 minutes. So, or been feeding for as little as 15 minutes. So just something to keep in mind. I think a lot of the numbers that are thrown around out there are that it needs to be or it has to be latched for 24 hours in order to get infections from it. And that's not true. So just to keep that in mind. So if you were bit by a tick, now what? Definitely get the tick tested. I will add in a caveat to that. I recently had a friend, colleague reach out asking about, what do we do for ticks? And her son was bit, all these different things, and kind of freaking out a little bit, as, a caring mother does, or somebody very often would. If the tick has not latched and you're just curious, wonderful, go for it. If you feel like your sanity will be very disrupted by knowing what is in the tick or ticks around you when you haven't had any Lyme disease, I would encourage you to do what you feel like is best for your sanity, because worry, and we'll get to this as well, or emotional components of chronic diseases and just really of health overall, are really, really a big part of health that I dig into personally as a naturopathic doctor. Not everybody does that. It's really important to monitor and take action based on how you are going to feel. So if you think that, you're outside every day, you have a ton of ticks around your area, or you do it for work or whatnot, and you find these ticks around and you collect them all and you send them in, and you find out that they do have different Lyme or Borrelia or any of the co-infections, and you're going to be super paranoid to never go outside again, or be scared or be worried every time you see a tick, I would actually encourage you not to get it tested. If you think that you get a bite, you could actually even have the tick on hand. You could, send it in, maybe don't look at the results until you need to, or whatever it is. I just really encourage you to take that into consideration of what will serve you better. Because if you will be worried and you're going to be super paranoid for yourself or your family members, chronic worry will cause more health issues than a tick that didn't latch. So I just want to put that out there and let you do with that what you will. If you have been bit, and really for any health issues, anytime somebody's starting to get sick or you're concerned about being sick, do your nutrition due diligence. Absolutely no sugar. Sugar suppresses the immune system. 1 tablespoon suppresses the immune system for about 5 hours. So you have a little sweet thing in the morning, and then you have a little sweet thing as snack 3 hours later, and then you have dessert after dinner, and you just suppressed your immune system for 15 hours. So it's not worth it. Just cut out all sugars. Typically, like honey's okay. It doesn't really have quite the same effect, but certainly all processed sugars. Sleep is absolutely important, and we do not do this well enough in our society at all. We have a pushes to get things done, and we, go about life, and everything else takes priority, especially over sleep. We'll continue to go to bed later. The dishes will be there in the morning. The house doesn't need to be clean. You do need your sleep. So do all your due diligence. If you have been bit and you want your immune system to function in tip-top shape, please get your sleep. General immune supports. Hydrotherapy is a contrast of hot and cold. I would do this under the supervision of somebody, or have a particular recommendation given to you for what kind of hydrotherapy to do. I think there's a lot out there now on doing those like cold dips, or doing contrast showers where you do hot and then cold, especially if you have blood pressure issues. That can sometimes be a problem because your blood pressure can drop pretty significantly with the vasodilation that happens. So it's like more blood flow to all of the little areas of the body, and your blood pressure can drop. So if you do have health concerns with that, if you get dizzy easily, if you have low blood pressure, I would definitely consult someone and or have a specific recommendation given to you for that. So just be cautious with that. General immune supports: vitamin D, vitamin A, vitamin C, zinc. Vitamin E can actually be really helpful as well. So you can take the daily recommended dose. Typically, if I'm giving a dose for somebody who has been bit, I dose them pretty high, because we want the immune system to be as fed as possible. Just as an example, vitamin C you can take to bowel tolerance, which means that when you have too much in the day, you will get diarrhea. If you do get diarrhea, wonderful, you've hit bowel tolerance, you can back off a little bit and divide that into multiple doses so that you're not actually taking, 15,000 or 20,000 milligrams all at once. Thanks, Jody. Take care. And you can decrease the amount that you can separate the amount that you're taking. So if you got up to 15 or 20,000, you could actually separate that into and take 5 in the morning, 5 at noon, and 5 at night. And when you're sick, you can almost always triple that before you would hit your bowel tolerance again. So that's just as an example. I'm not suggesting anybody do this. Please, again, talk to your healthcare practitioners as to what would be best for you. Just as an example of how much more your body needs when it's actually fighting something. Herbal remedies, there is a concoction or a combination of herbal remedies. We just label them as antimicrobial 1 and 2 in our clinic because we use them all the time for so many things. And they are all of the herbs in a balanced formula that are meant to treat Borrelia and all of the co-infections. And so that's what I use to actually treat Lyme as well, or the co-infection. So it's what I would use to treat those if somebody did have symptoms. And so that's what I would also use if somebody had a bite. It's essentially, instead of antibiotics, or if we can't get antibiotics. Antibiotics are still a very good idea, especially if you do think that it latched or there's any risk of Lyme, or a tick comes back and it has Lyme. that did latch on you, I would suggest doing at least the herbal remedies and or a combination of all these things and the doxycycline if you can. Homeopathic Ledum is a great one for anything that bites. And sorry, there's just a question there, so I'll stop and just answer that. If you get bitten all the time, can you take those herbal remedies as preventative? Yes. So the herbal remedies, as opposed to antibiotics, I really like them because, I mean, it's kind of my world anyway, but I really like them because they are supportive for the immune system. So they won't wipe your gut flora out or anything else like Doxy will or any of the other antibiotics. So if it's an ongoing thing, I mean, I take herbs every day. You may be able to hear that I'm a little bit stuffed up. I'm not sure if it's from the cat or it's allergies or something like that. But I do take herbs on a fairly regular basis and just go through them. People buy me herbs for my birthday, and I'll take that for a month or two. And they typically are really quite supportive and typically stop people from getting sick on a regular basis anyway. We do have IVs. It's just written there beside Ledum. Oh, sorry. So the homeopathic Ledum is for anything that has a puncture wound. So if you have a bite or something that would have poked through the skin, Ledum is a great remedy to take or to use in that case. So we're going to get to more specific herbs later, but I was just talking about the herbal concoctions that we have, we just label them as antimicrobial 1 and 2. So we'll get to some specific ones. The IVs, we have a number of different ones, so we'll talk about them in treatment. But if somebody wanted to do an IV and thought they did have it fully latched or whatnot right at the beginning, we can always do an IV or a couple IVs to essentially just give the full boost to the immune system to make sure that it's going to be fighting its best. Preventative testing. So often now I don't know this specifically because very often people will come to me once they are already sick in some cases, but I wonder how much is going on for people before they got bit, if they do tend to be the ones who end up with a chronic illness. So if we can do preventative testing on, I guess my recommendation would be that everybody get this test done. It's a test that, as one of these is a test, this little one with the dots all over the person there. I get it done once a year to try and use as preventative understanding of where my system is and where my health is. We can do even like a full understanding of where your health is at, get your blood work done, all of those things. Some of the stuff that comes along with Lyme, or the things that I think make more people more susceptible to Lyme, is when they're burdened with more of a comorbidity. So, and that in my world is like a really heavy toxic load. You're not able to detox properly. You may have mold illness, which comes often a lot with sinus issues. You may not be having proper bowel movements or urination. Just so everyone knows, proper bowel movements are at least once a day. People will say, oh, well, it's very normal for me, I only poop once a week. That is not okay for your detox pathways. So just the idea of like making sure that you're in a really good state and really good place. And the emotional piece, that stress piece, would be the other huge one. A lot of people a number of people that I can think of who have more of a chronic Lyme disease, came from a place of being super type A, super hardworking, possibly I would say stressed to the max for a really long time before they got sick. And I would say probably a very similar thing for people who have fibromyalgia or chronic fatigue is that you go, 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 and push, 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 push. And then at some point your body isn't able to do it anymore. That was just sort of the last straw that broke the camel's back. So again, chronic Lyme disease testing this is more specifically than for Lyme. Armin Labs is a lab in Germany. We usually run ELISpots. You can run other IgG and IgM tests for that too. So ELISpots, what ELISpots does is look at the T cell activity. This is a part of the immune system that is activated much earlier on in the whole your immune system's getting ready to deal with Lyme or a co-infection. It's activated at really like way closer to the beginning. What our tests typically do, which are actually the Western blot and the ELISA, is the third point there. Those are the ones that are run in our system. those ones will measure the antibodies. So antibodies, there are a couple of research studies that I looked at. Antibodies are not always made. So sometimes people just don't make them. Sometimes people's immune systems are so low, which you could actually see sometimes in their white blood cell count or some other measures of their white blood cell count, which are their CD numbers. And their immune system is so low that they don't make enough antibodies to register on this particular test. So the idea that some people don't make them, the idea that they may be too low to register on the test, and then that themselves, the Western blot and the Lysa for Lyme in particular, it's only about, and there's a quite a wide range of about 30 to 60% accurate. So all of those together is very indicative, or at least telling, that our tests are not amazing for the ones that we actually have done through the system, which is why we usually run one of these other two tests. So Iron Labs is the one that I usually run because it is the component of the T cell activity, which is earlier on in the immune system. And then DNA Connections is actually a PCR test, which we may have heard being similar to the COVID tests. PCR tests are showing that that particular virus is around, but it doesn't actually show that that particular, or virus, sorry, in this case it would be bacteria. It doesn't actually show that that bacteria is causing the infection. So it just says, yes, it's there. It doesn't show us if it's dead. It doesn't show us if it's alive. It doesn't show us if it's activating the immune system. It just says that it's there. The benefit of DNA Connections is that it is a urine test. So I've used it for kids before, or anybody else that didn't want to do a blood draw. And again, if you're having all these symptoms and it does seem present, and it does a number of the different co-infections as well, it's possible we could at least try and see if we can address it with an infectious approach. Testing the body in the terrain and sort of seeing what else is going on, we can do that control the seer thermography. Oh my goodness, I'm having a brain fart right now of what it actually stands for. Control regulated thermography. It'll come to me. I run these all the time. But anyway, the thermography is what this little guy here with all of the dots was representing. And what it does is actually assesses a number of the different systems and essentially shows us the weakest link within the body, and how it's sort of doing. So it can look at your detox function, it can look at your liver, it can look at your heart, and just understand, like, are those pathways functioning to their optimal, or do they seem to be struggling a lot? Other tests that we can do, obviously we'll look at sort of general health, we look at blood work, we do other physical assessments as indicated, and we have a ton of other testing. So we can look at mold illness, we can look at heavy metals, especially if people have a history of working with them, or if they tend to have low detoxification pathways. We pick up heavy metals from everywhere. There's a lot of stuff that we're exposed to just in the environment, a lot of stuff that we're exposed to through gas fumes and smoke and different things like that. So there are different ways that we can assess for other things that would put that burden on the system that often can stop people from getting better when they do have more of a complex chronic illness. And so our treatment options. These are the ones that I'm going to go through. I will actually specifically talk about some different herbs and whatnot. If you have questions about specific herbs, I can actually get into the particular ones. Emotional homeostasis is the first one we're going to talk about. General terrain. So both of those are really for any illness, I would say, or even just health in general. And then antimicrobials, modulating the immune system, and supporting the body are the approach that we take with every step along the way when supporting somebody with Lyme disease. Emotional homeostasis. Stress impacts us so much, and I don't think there's enough understanding or emphasis on how we respond to it and how it actually can affect our own health. So some of you may have a difficulty with me stating these sorts of things, but I really do truly believe that our emotional our emotional health has such a huge impact on it. And I think everybody will always agree, like, oh, yeah, when I'm stressed, everything gets worse. My sleep gets worse and my pain is worse. And when I don't sleep, then my pain is worse. And everything kind of snowballs in that way. And things always seem way harder when you're stressed. And so that is a very common and maybe accepted approach. Um, my other thoughts are that you are not always responsible for what comes into your life and how you get sick, but you are responsible for what you do with it. And that sometimes can be difficult because it's not a blaming anybody for having a particular illness, but you are the only one that can put that particular stuff in your mouth. You're the only one who's going to not put the particular stuff in your mouth. You're the only one who's going to come to appointments or do different things or make sure that you get out in nature to help your nervous system relax. And so that responsibility for people to take as their own is really important. Cortisol levels rise with worry or with any kind of stress, and that is sort of indicated in this picture here. And you maybe can't control all of your thoughts, but you can control how you respond to them. Can't control what other people say to you or always what's thrown at you, but your reaction is actually where the stress comes from. And this is why I tend to focus so much on the mental emotional piece for people, is because if we can regulate this, it makes everything else easier and makes everything else fall into place way better. If we try and, give you as many herbs as you want, and every other minute of the day you're super worried and very stressed out and just kind of falling back into really difficult negative thought patterns, all of the herbs in the world, in my opinion, won't fully change your state. You can get people better to a particular point. When I see people really plateau, it's the emotional piece that's missing. So this one, in my opinion, I put it right at the top because it's one of the most important things to deal with. We very often also will deal with the stressor, but we never deal with the stress. So we, finish the day and go from one thing to the other and help everybody out with all of those things. I go to all my appointments and I do all of that stuff. And then we don't fully come down from that stress and fully allow our stress to finish the cycle, as opposed to the stressor being completed. We don't allow our stress to be completed. Hopefully that makes sense. Okay. Terrain homeostasis. So this is another one that is general to a naturopathic approach. It is the ability to clean up and balance. So homeostasis means balance. So our cells sit in a soup, if you will, kind of a sort of soup. And like this picture, there's a cell and then there's kind of all this blue stuff around it. And we don't usually picture, I think, our cells sitting in this. But as we expose the cells to different things, they actually will respond based on what they're exposed to. So again, this is where, the stress cortisol hormone comes into play. If our cells are fully bathed in cortisol all the time, they respond very differently than if they're not bathed in cortisol and they're bathed in other things that they're supposed to be bathed in. And kind of like us on a sunny day, like you have sun 3 days in a row and your mood just gets better and better and better. And then you have gloomy for too long and you kind of start to be draggy and maybe not functioning quite as you should, and not hopping out of bed as you should. And that's what our cells are like, depending on what we expose them to, which are our hormones, including those stress hormones, which are the things that we eat, which are the exposures that we have in the external environment. Some of those we can control and some of those we can't. So the ones that we can control and the ways that we can support that, in naturopathic medicine, we have these different types of drainage remedies, essentially, is how they're termed. And so that can help to move the soup and to change the soup that your cells sit in, is by doing these sort of quote unquote detox things, or being able to drain out the toxins from this area of the body that they kind of can get stuck in. So herbal remedies. If you're looking for great resources, Stephen Buhner is an awesome resource. He's a herbalist that recently passed away, and he has a number of different books on Borrelia, and I think several books are in. I don't know which ones go together, but like a couple of the co-infections are together, and I think he has 3 or 4 books on it. One of them is called Healing Lyme. And he's a really, really great resource for herbal remedies. those three categories that we want to address with herbal remedies is the antimicrobials. We want to modulate the immune system, and then we want to be able to support the body for whatever it needs support in. And that's where we come back to, well, are there any other comorbidities? Like, is there other detox issues? Is there GI issues? Are there maybe an overgrowth of bacteria in the small intestine or the large intestine? Or are there other things that need to be supported? And herbal remedies can be used for all of those categories. I think maybe people wanted some ideas of the herbal remedies, so I can mention a few of them too, if that would be helpful. So Japanese knotweed is one that is kind of a broad spectrum immunomodulator. It does have antimicrobial activity as well. In TCM, which is Chinese medicine, there's different qualities of herbs, and it can be used for sort of termed as invigorating and clearing the blood. Doesn't actually filter the blood in itself. It can be clinically effective for Lyme as an immunostimulant, immunomodulator. It is antibacterial, anti-spirochetal, which Borrelia is a spirochete type bacteria, so we want it to be doing that. Antifungal, it can be protective for endothelial cells in the body, and it can be quite specific for Lyme and Bartonella infections, especially because of that spirochete component of it. It's also really good for microcirculation. So if there are issues with the eyes, or the heart or the skin or joints, especially smaller joints, it can be really, really helpful for Lyme in those particular cases. It does also cross the blood-brain barrier, which is really important for any of those central nervous type systems, symptoms that could be associated with Lyme or the co-infections. So this is one that I pretty much always use. Chinese skullcap is also one of my favorite ones. It can be very calming, so especially if there's a bit more tension or anxiety that comes along, which there can be it's almost like an internal anxiety that comes along with these different types of bacterial infections. It can help to calm that a little bit more. It's in the TCM qualities, it tends to be more bitter and cold, and so it clears heat and expels damp heat. And these again are from the traditional Chinese medicine side of things. It also has a bit of a focus on that central nervous system infection, and it can help and support memory dysfunction and reduce neuronal damage, so actually damage to the nerves themselves. It can also help through the cytokine cascade. So we may have heard a little bit about cytokines through some of the COVID stuff in recent years. And when cytokines can get really activated, essentially it can create a lot of inflammation and sort of perpetuate the immune system to be spinning its wheels in a bit of a way, and it can really help to modulate that. Which other one do we have here? Theta acuta, and well, cat's claw would be another one that I also would put into pretty much all of my different remedies there. Green tea, actually, at least we can cover some of those ones that you would take internally that you can do at home. Green tea is a really great antimicrobial, antibacterial, semi-antifungal remedy as well. It's very protective for the mitochondria, which produce energy, so that's really helpful. It can be helpful for nerves and joints. And it increases activity of glutathione, which is a really strong antioxidant that the liver tries to create. And often glutathione can be very depleted, especially when we have these high loads of toxins as well. So those are a few that you can add in. Other ones that like generally herbs, they're almost all antimicrobial. So things like chamomile tea or echinacea, any of those ones, they may not be specific for Lyme, but they will always help to support your immune system and at least help to get rid of some of the other things that your immune system might be dealing with if it happens to be dealing with multiple things at the same time. Homeopathic remedies. I mentioned Lyme before. I would have liked to change this slide to also add in low dose immunotherapy, which is essentially almost a homeopathic remedy in terms of them being a similar style of medicine. You can get homeopathic remedies that are more for your constitutional picture, which means everything that you present with. And again, as I mentioned, people in these situations often will present totally differently. So we can use the homeopathics in a way that can be very individualized for how people are presenting. Ledum, as I mentioned, is one that is really good for puncture wounds. So with the acute bite, it can be effective for that. And then low dose immunotherapy is something that we can use when the body isn't being effective anymore. So it's sort of in that immunomodulating component. The idea with immunotherapy is that the body can almost spin its wheels when it's exposed to something, and there's something coming in that could be causing a reaction, and then there's the reaction of your body towards the thing. And some of the stuff we should have around like normally, like yeast and different things like that. Sometimes Lyme, whether it's fully ever eradicated, is a little bit of a question. We're not 1,000% sure if it is fully eradicated, or whether it may stay in the body. But if it stays in the body at a way that you don't have symptoms and that you're playing nicely, then there should be no issue with that. So yeast is another example of that. We always have yeast around the body, and strep was always strep around the body and on the skin. And when we don't have infections with it, we're all playing nicely together. Sometimes the body can almost have, for lack of better terminology, almost have like a bit of a reaction to the thing. So it's overreacting just because yeast is there, even though it's very normal for the yeast to be there. So we can use LDI to help it to react normally. So we do actually have these for Lyme and all the different co-infections, that if the body seems to be like the infection almost seems to be essentially gone, but the reactivity and the symptoms are still there, then we can help support the body from the other end for it to not be overreacting to something that is there in small amounts, or that it shouldn't be overreacting to. Other things that we use in our clinic, which many people don't know naturopathic doctors do, we do IVs and quite a number of injections. Often these are very specific for the person as well. So injections can be pain-based. Neural therapy is one of them. Prolotherapy, prolozone, or another term of is platelet-rich plasma, which Joe Rogan has some interviews on, and a couple of different things. So you may have heard of those before. Those can all be used for joint issues themselves. They can be used to help repair joint tissue, in addition to helping with chronic pain in those areas. The IVs, we have a number of different types of IVs. So we have ozone IVs, we have Myers, which are nutrient-based IVs. We actually have an IV laser that has UV and other different various colors, and they all kind of do different things. Very interestingly, at least to me, we have photoreceptors on the insides of our body, on our organs, which is very strange because that means that they are receptors that respond to light and different colors of light. And that is strange because our liver doesn't usually see light. But if we can add in a laser to our bloodstream and actually allow the blood to pass through that, we can actually activate different cytokines, these different little chemicals that can create or change the pathway of inflammation by actually adding in color to the bloodstream. So, some really interesting things that can sometimes make a tremendous difference for people. And one of my last and favorite ones is bee venom therapy. This is fairly new to me as well. I know a few people who have gone through the treatment for this, and one of them, she would say the naturopathic doctor saved her life, being quite ill with Lyme disease, and bees gave her life. So bee venom therapy you can use to you'd actually use the bees to sting. They have different types of bioactive components within the bee venom that can stimulate the immune system, that can have they have like really amazing antiviral effects and antibacterial effects. And the bees themselves make, honey, and everything else that they make are incredible. But the bee venom therapy can make a tremendous difference, especially in those later stages when we may have checked for mold and checked for a number of different things because there are certain circumstances where we wouldn't use bee venom therapy, especially if there's a lot of histamine or that mold kind of reaction or histamine reactions. People can have really negative effects to bee venom therapy. But if that stuff has all been checked out, the peptides from the bee venom can make a tremendous difference. And it can really, actually, being with bees can really help to regulate the nervous system as well, which sometimes doesn't sound like it when you're talking about bee venom therapy. People just get a little nervous, but actually being around beehives can help the nervous system to completely regulate. There's lots of research on that with anxiety and PTSD and different things like that. So some places that you may not want to use bee venom therapy is if people do have mycotoxins, so mold exposures and an active mold issue within their body, or if their vitality really does need to be quite good in order to do bee venom therapy, and a lot of determination because it is quite an intensive therapy, and the protocols really are quite intense, but they can be absolutely life changing for people. And so if you know anybody or end up being in a situation where you really have no quality of life and these can start to give you that life back, there can be a tremendous, tremendous difference from this. Supporting the body. So again, this kind of wraps up our whole naturopathic approach in that as we do all of these different things, we'll always take that approach of understanding what the antimicrobial components need to be, understanding what the modulating the immune system needs to do, and then being able to restore and repair. And if we have different systems of the body that need to be supported during those times, you can't just do antimicrobials and have everything typically sort out perfectly. There can be damage that is done. A lot of those microorganisms and the bacteria love to steal different nutrients from places and joints in particular. So we want to be able to help those joints repair, help nourish and replete the body in different ways. Again, I mentioned this already before, a number of different co-infections. So as we're supporting the entire body, we do really want to make sure that we are addressing any other co-infections that might need to happen or might need to be addressed in that particular person. Resources and supports. So I, again, am Dr. Cheryl Karthaus. There are a number of different doctors at the East Coast Naturopathic Clinic. Dr. Brian Reid has been doing Lyme for much longer than I have. He is one of my mentors, and he's at the clinic there as well. And our other fabulous doctors all are well versed in Lyme. And there are other NDs around the city too. So lots of people have taken additional courses, and we discuss cases if anybody ever gets stuck. So if you do want to just reach out to your local ND, either if they do it or they'll be able to refer you to somebody who does do it, or you can just check around and find somebody who does if you want the support from one of our NDs. CanLyme website is an amazing resource for a ton of stuff. So they have different tools if you're looking for them. They have videos on how to remove ticks. They actually have a video coming up, and I have a picture of that. So I'll just hold on describing the rest of that. Lunenburg Lyme Association, they have a Facebook group. And there's a symposium coming up on May 29th at the Legion. I don't think it's in Bridgewater. But anyway, that you can check that out. Make sure you get all the information. Don't base that on what I am telling you here. And there are other organizations. Lyme Disease Treatment Foundation.org is one that actually provides some funding for people with Lyme. So you can actually apply and get funding. And I have a couple patients who have successfully gotten funding from them. ILADS is the International Lyme Association, and they have a lot of the base protocols. They do a lot of the research. They have symposiums every year. So a ton of information there if you're looking for more. So this is ILADS. Oh yeah, they also have a webinar coming up. It's on May 31st there. I had issues registering. I don't know if it was their system was down or something like that, but you could always go to ILADS and try and register for that. And this is the documentary screening that is coming up with CanLyme. It starts tomorrow, but they will be doing a couple of them. I wasn't quite clear on the information. It says to contact them for that. So one screening tomorrow, and there will be several online, and then they will be doing a screening with a Q&A, I believe, on the 27th. Does anybody else have questions that I haven't answered yet? You can always post them in the chat there. Okay. So it is 8:30. It's going over a little bit more, especially with that huge delay in when we started. But we'll get through the tick repellent stuff here now too. We will actually be recording this. So yeah, I'll have this recorded, and then maybe we'll just have to figure out the best way to get it to people. So maybe I'll send an email out to everybody who registered. So I know there's a number of people who weren't able to make it tonight. There's a mix up of dates and whatnot. So maybe we'll try and get the recording out to everybody who tried to register. And here are the essential oils. We're just going to do that now. So these are a number of different essential oils. I really love doTERRA. My sister started selling doTERRA a little while ago. That's Yvonne Mackey actually down there. And I meant to put her contact information in there, but you can always try and contact me as well. Maybe I will actually, I'll put her information in the chat and stuff. Oh, can I do that? There we go. I actually can. doTERRA is a company that I feel has quite good integrity. People may have heard a number of different things, but as far as a company goes, they seem to have really, really good integrity, and they have great, wonderful testing. So, yeah, I'm just putting in her email here. They have awesome testing for their oils, and you can go on and search any bottle and actually look into like where the bottle came from, what the testing was based on it, like all those kinds of things. So when I started a business a number of years ago and made different body creams and stuff like that, and I extracted my own oils, and then I wanted to put essential oils in to make them smell good. And the kind of response that I got from companies when I asked them for, well, if I'm going to be giving this to people that are ill and I want to really only support health, like I want to make sure that their oils aren't contaminated because they're not regulated very well. There's not really any standard for oils in Canada. So I wanted to make sure that I could see that they were tested and didn't have additional chemicals in them and didn't have inorganic chemicals organic chemicals that shouldn't be there, like additional molds and whatnot. Like these are things that should be pure. And I had one of the kind of health conferences that I went to, I asked the guy, and I think he was the vice CEO or something, and he basically chucked a binder at me and was like, "Oh, well, the information's in here somewhere. Like, good luck." Like, okay, like I wanted to start up a big company and hopefully give you lots of business, and like these are the kinds of responses they have. So I've just found doTERRA awesome to work with in terms of that side of it and understanding where they come from and all of that sort of thing. But there are lots of other oils. doTERRA does tend to be a little bit more expensive. So there are different versions. I would just really encourage you to find out where they're from and to make sure that you can get some indication of the quality of oils as well. So essential oils, I love them. This is one of the things that I would have in my toolbox all the time. One of the other main reasons as well is because they don't really expire. They support the immune function. They can decrease, you want to make sure that we're decreasing toxic exposure through the quality of them. They can definitely improve mood. They are antimicrobial, and some of them can be anti-Borrelia, Lyme specific. And then we can use them for so many different purposes. So for the tick repellent and whatnot. So let's get into that. So here's a little bit of research on some of the oils. Lemongrass is one that is used quite often. Geranium rose is another one that is used quite often. The research there on lemongrass that I read some more recently that actually starts to disrupt the like Borrelia, the Lyme bacteria's mitochondria. So it actually kills kind of from a cellular level on the inside. So that is kind of a good thing. And then the thyme and oregano are other ones that have been demonstrated to improve or to have a good amount of tick repellency, and rosemary as well. And these are ones that have been approved by the CDC government as a natural Lyme repellent. So there's rosemary, lemongrass, cedar, peppermint, time, and I can't move the chat box here, but I'm sure you guys can read all of the oils there. So I have a couple different recipes. This one's a little bit more complicated. Lemongrass, oregano, or thyme. This can be really strong for people with sensitive skin. They I would you either omit it or just use a really small amount, especially for kids. It can be quite burny on the skin, and you definitely don't want to get it in your eyes or anything like that. Which again is why lemongrass tends to be used so often because it's way more gentle. It's not going to hurt or sting. Rosemary also has a really strong menthol smell. It smells more like eucalyptus sometimes than eucalyptus does. So that one also can have a very cooling effect on the skin, and it can be disruptive sometimes for sensitive skin. And then the geranium rose is another one. It also has a really strong smell, which is actually a good thing because part of the thing you want to keep in mind, part of the issue um, with an essential oil tick spray is that it needs to be smellable in order for it to be effective, and any kind of bug spray. So if you can't smell it anymore, if the ticks can't smell it and the bugs can't smell it, it won't be effective. So it does often need to be reapplied. Geranium is quite a strong smell, and it can often last quite a long time as well. Optionals to add are cedarwood, cloves, and spearmint. And again, those ones are all shown to have some effects with Lyme. And one of these easier ones is just lemongrass and geranium. I usually put a little bit less geranium, or might even put way less geranium than 30 drops, again, because the smell is so strong. And usually you would add witch hazel, or you can actually use apple cider vinegar instead, something else that helps the oil and the water to mix a little bit. You can actually put a little bit of alcohol in it. So apple cider vinegar, witch hazel, alcohol, and then I would also add in just a small amount of coconut oil, like a liquid coconut oil or a liquid oil of some sort that you're okay to put on the skin, just to help those oils to disperse better in the actual substance. So I can, and these are other ones as well that are already pre-made. Lisa Learning is the woman who started this company, and she's actually going to be at that Lunenburg conference, so you could go and meet her there if you wanted to. She has the Atlantic outdoor spray. The lemongrass one has been around for quite a while. She's lots of testing on that. And then the other one is actually quite new. It's a lemon eucalyptus. And those ones are often used. I think they're for pets and whatnot. She has a new one. I thought that was the new one that was coming out for pets, that it's a little bit safer for them. Oh, how much water do you use for the recipe? So these ones are, you can put them in a 10 ml bottle, and I would just use about a tablespoon of witch hazel. You could actually add a tablespoon of another oil, of the coconut oil or something like that, and then fill the rest up with water. So it ends up being, I don't know, probably at least probably about a little more than half water. But you just fill the rest of the container up with water, and these are usually in 10 ml bottles. Black pepper. Confused if black pepper EO has pepperline. So was that in on this slide up here? Oops, let me. Peppermint, black pepper. I'm not sure if I hadn't read the research on it. I mean, there's a ton of different ones. Like I read a bunch of different research on clove oil and like all these different things too. So there's I'm sure there are lots that are like similar, as I'm saying, most herbs have at least some antimicrobial activity of some sort. So like chamomile is often used as soothing and to the digestive system and calming and whatever else, and it's antimicrobial. So I don't imagine, like, especially essential oils in such a strong concentration, they very likely have some repellent activity. If they haven't recorded how much repellent activity, I'm sure you could always add it in. You just may not want to take away from another one that has, been shown or been studied in that way. Okay. And I'll just, oops, pop on here again. There we go. Hi, everyone. So some of the oils I can just show you here. You want to make sure to use a glass jar that has a spray lid on it, not anything that's plastic. I actually was just going to reuse this jar to show you, and anything that's plastic actually will degrade with essential oils. So the tubing from the spray part here actually is broken because this is a very old bottle that I have used several times. So we do need to replace all of the plastic pieces that you're using if it's going to be associated with essential oils. So always put them in a glass jar. If you even want to remove this part and remove the whole spray top and store it, especially if you're not using it off season, store it with just a plain lid on it in the cupboard or something somewhere if you have some left over. And then you can just put this in during the seasons that you're using it, or even at the time that you're going to use it. So these are the essential oils typically that I would use. Now we have geranium and the lemongrass here, and there is a lemon eucalyptus here that that doTERRA has, and then there's all the other ones there too. They also have a fractionated coconut oil, but again, you can get just regular fractionated coconut oil from anywhere else. And then you want to be able to mix it with, again, that witch hazel or activated or apple cider vinegar or alcohol to make sure that that version of the oils in the particular solution. So that's all I have for you all tonight. If you have any questions, please don't hesitate to reach out. Maybe I will try and send my email, or I can actually put it in here as well. I'm at the East Coast Naturopathic Clinic, so that's one way to get a hold of me there. And maybe I'll see you at some of the conferences that are upcoming. Thanks all for joining tonight.